Hello everyone, welcome you all in our YouTube channel Learning Radiology. Then start out today's topic. Today we will discuss on the topic sterilization. तो आज के वीडियो में हम स्टरलाइजेशन के बारे में बात करेंगे. वीडियो के लास्ट तक बने रहिएगा. स्टरलाइजेशन बहुत ही इंपॉर्टेंट टॉपिक है. आपके जो बीएससी के बच्चे हैं उनको थर्ड ईयर में पढ़ना होता है. डिप्लोमा वाले बच्चों को भी पढ़ना होता है. एग्जामिनेशन में पूछे जाने वाला भी क्वेश्चन है. चाहे वो रेडियोलॉजी के बच्चे हैं तो उनमें भी पूछा जाता है, और हमारे अगर जो लैब के डिप्लोमा होता है वहाँ पे भी ये क्वेश्चन पूछे जाते हैं कई बार. और जो यूपी स्टेट मेडिकल फैकल्टी के जो एग्जामिनेशन होते हैं उसमें भी पूछा जाने वाला बहुत इंपॉर्टेंट टॉपिक है. पूछा जाता है, वो लोग भी पूछते हैं, एग्जाम में बहुत आता है. तो बात करते हैं स्टरलाइजेशन होता क्या है. मीन्स बेसिकली वी आर टॉकिंग इन दिस टॉपिक about the definition, what are the definition of the sterilization, and what are the different types of sterilization, and what are the subtypes of sterilization. Sterilization means it's a area which is freeing from microorganism. Means sterilization is a process of freeing an article or an area from a microorganism, including their spores. Means sterilization means freeing this area free from microorganisms. What is the disinfection? Disinfection is reducing the number of pathogenic microorganisms. Means this decrease the number of pathogenic microorganisms to the point where they no longer cause disease. What is asepsis? Absence of significant contamination is called asepsis. Bacteriostatic agent. Bacteriostatic agent inhibit the growth of bacteria but does not necessarily kill them. It only inhibit the growth. What is bactericide? Bactericide, it's a type of agent that kills bacteria. Most do not kill endospores. What is sporicide? Sporicide is an agent that kills spores. Bactericide kills bacteria, but they do not kill endospores. But sporicide kills spores. What are the methods of sterilization? We are categorized sterilization into three categories. Physical agent means they are the type of sterilization. Then you look on a screen, microbial control are divided into three categories. First one is a physical agent, second one is a chemical agent, third one is a mechanical removal. In case of physical agent are subdivided into two categories: heat and radiation. In heat are divided into two categories: dry heat and moist heat. In dry heat there are different type of heat like red heat, flaming heat, incineration, or a hot air oven. These are the method of dry heat sterilization process. And boiling and autoclave are the types of a moist heat sterilization. Radiation are ionizing or non-ionizing. In case of ionizing we use X-ray and gamma rays. In case of non-ionizing we use ultraviolet rays. Dry heat is used to kill by denaturing of the bacterial protein, oxidative damage. And red hot means in oscillation loop or a wire, the tip of forces and spatulas are held in a Bunsen flame till they are red hot. The flaming heat. Flaming type of a flaming sterilization means flaming pass through the Bunsen flame without becoming red hot. Glass slides scalpel mouth of the culture. Incineration is a process, and it is a very excellent method of the destroying materials such as contaminated cloth, animals, carcasses, and pathological material. These are the incineration process. You pack every material, then dump into this chamber. It's a chamber like a structure. Hot air oven is operated at a 160 degrees Celsius for 2 hours, or a 170 degrees Celsius for 1 hour, 180 degrees Celsius for half an hour. There is a thermostat controlling the temperature and a fan to distribute hot air evenly. And the double walled insulation keeps the heat in and conserve energy. Usage of hot air are to sterilize forceps, scissors, scalpels and swabs. The other precautions should not overloaded. Material should be dry perfectly. Cotton plugs, test tube, flask, etc. Any inflammable material should not be kept open, should be allowed to cool down 2 hours. Most heat sterilization they use for kills microorganisms by coagulating their proteins. Most heat sterilization method are temperature below 100 degrees Celsius means pasteurization or inspi shatter. Temperature at 100 degrees Celsius means boiling. Steam at atmospheric pressure, Corsa or Arnold's steamer. Steam under pressure, autoclave. Temperature below 100 degrees Celsius means pasteurization. Holder method 63 degrees Celsius for 30 minutes means holder method and a flash method. To holder method and a flash method, then immediate cooling to 13 degrees Celsius for a lower. Inspi session means sterilizes by heating at 80 to 85 degree for half an hour for 3 successive days. Sterilizing media, Lowenstein, Jensen or a Loeffler serum. Vaccine bath to inactivate non-sporing bacteria for preparation of vaccine. Minus 60 degree Celsius for 1 hour is used. Low temperature formaldehyde 75 degree Celsius means used when items can be withstand 100 degrees Celsius. Temperature at 100 degrees Celsius means boiling. Kills vegetative forms of bacterial pathogens means they are used for kills vegetative form of the bacterial pathogens. Hepatitis virus can survive up to 30 minutes of boiling. Endospore can survive up to 20 hours of or more of boiling. Tyndallization or intermittent sterilization. They are used for media containing sugar and gelatin exposure for 100 degrees Celsius for 20 minutes for 3 successive days is used. Steam at atmospheric pressure. Steam is generated using a steamer. Consists of a tin cabinet, has a conical lid like this. Has a conical lid like this. They enable the drainage of a condensed steam. Perforated tray of the insure material and surrounded by a steam. For routine sterilization, exposure of 90 minutes is used. Most of the vegetative forms die except for thermophils. These are the steam sterilization. Temperature above 100 degree to steam under pressure means autoclave. It consists of a vertical or a horizontal cylinder, and this part is a open end, has an opening which is meant for keeping material to be sterilized. This is a lid is to provide with the pressure gauge to measure the pressure, and this is a safety valve to permit the escape of a steam from the chamber. And article to be sterilized are placed in a basket provided, and sterilization is carried out under pressure 121 for 15 minutes. This is the process for 15 minutes for sterilization. Then radiation means ionizing and non-ionizing. Case of ionizing radiation. In case of ionizing radiation sterilization, we use X-rays and gamma rays and cosmic rays. They have a high penetrating power, no appreciable increase in the temperature. Means cold sterilization uses like sterilized plastic syringe, catheter, grease, fabrics, metal foils. In case these are the ionizing radiation diagram, these are the non-ionizing radiation. Means infrared, we use infrared and UV ray. Infrared for a rapid mass sterilization of catheter and syringe. For UV ray for bactericidal activity used for disinfecting enclosed area, labs, OT. There are microbial control of till we discuss only physical agent. Then we discuss chemical agent means liquid, gas and particles. In liquid have alcohol, aldehyde, halogen, phenol, diet and halogen. These are the types of liquid chemical sterilization. In case of gas chemical sterilization, we use ethylene oxide, formaldehyde, gas, beta propiolactone. And in case of a particle chemical agent sterilization, we use surface active agent, metallic salt. The level of disinfection like low level, intermediate level and a high level. Low level are used for such items that come in contact with a patient but do not penetrate them. In case of intermediate level, they are not effective for bacterial spores, used for instrument, fiber optics, endoscope. In case of a high level of disinfection or a high level, we used on an instrument like for high sterilization, surgical instrument kill both vegetative and spores. So liquid sterilization, we use alcohol, ethanol, isopropyl alcohol frequently used, no action on spores, concentration recommended 60 to 90% in a water, used for skin or antiseptics. In case of aldehyde, formaldehyde is a bactericidal, sporocidal and has a lethal effect on a virus. To preserve anatomical specimen, destroying anthrax spores in hair and wool, 10% of formalin plus 0.5% of sodium tetraborate is used to sterilize metal instrument. Glutaraldehyde is an effective against tubercle bacilli, fungi and virus. They are used to treat corrugated rubber, anesthetic tubes, face mask, plastic, endotracheal tubes, metal instrument and polythene tubing. In case of halogen, iodine in aqueous and alcoholic solution has been used widely as skin disinfection, actively bactericidal with moderate against spores. Chlorine and its compound have been used as disinfect in a water supply and swimming pools. In case of phenol, obtained by distillation of a coal tar, powerful bactericidal, they damage cells membrane. Phenolic derivatives have been widely used as disinfect for various purposes in hospital. Example: Lysol, Cerozol, Dettol. The usage of phenol are like various combinations are used in the control of pathogenic coca in a surgical and a neonatal unit in hospital. Like aqueous solution are used in the treatment of wounds. They are aniline dye. They are brilliant green, malachite green and a crystal violet, active against gram-positive bacteria, no activity against tubercle bacilli. Acridine dye, orange in color, effective against the gram-positive. Then gram-negative importance dye are proflavin and acryflavin and euflavin. They are types of gases like ethylene oxide. They are colorless, highly penetrating gas with a sweet ethereal smell, effective against all types of microorganisms including virus and spores, and also especially for sterilizing heart, lungs machine, respirator, sutural, dental equipment. Chemiclave not suitable for fumigation, exposure and toxic. Formaldehyde means fumigation of operation theatre and other rooms. We use a door shield 48 hours to produce heat, gas irritant to skin and eye, so this nullified ammonia vapor. Or beta propiolactone used in a fumigation. For sterilization, 0.2% BPL is used. Has a rapid bactericidal activity, very effective against virus, but it is carcinogenic agent. Surface active agent, like substance which reduce the surface tension. They penetrate the membrane. Phosphate group cations are widely used in the form of quaternary ammonium compounds, marketed by bactericidal, active against gram-positive organisms, no action on spores, tubercle bacilli virus. Transducer are cleaned with this solution. Metallic salt, they are salt of a silver, copper, mercury and they also used as a disinfectants. Act by coagulating proteins, marked bacteriostatic, weak bactericidal and limited fungicidal activity. Mechanical removal. Sterilization by filtration means filtration helps to remove the bacteria from heat. level liquid sera and a solution of a sugar. Antibiotics. The following filters are used: candle filter, asbestos filter, centroid glass filter, membrane filters, air filter. Use and the limitation for this, like to sterilize sera sugar and antibiotic solution, obtain bacteria free filtrates, purification of water, retain the organisms that can be cultured later. Pore size 0.75 micrometer in diameter. Recent advances like OPA chemical Serlant and received FDA clearance in October 99. It contains 0.55% 1,2. Benzene dicarboxylaldehyde has shown superior microbactericidal activity when compared with glutaraldehyde. Okay, thank you. Subscribe the channel, like the video. Thank you. We will next meet in next video. Okay, thank you.